Hello, and welcome to another episode in Voices from the Disabled Community, produced by Adaptive Chicago Productions. I am Joel Margolis, your host for Voices from the Disabled Community, and I am pleased to say that with us today is Tom Wilson. Okay, Tom, may I mention the fact that you work for Access Living?
Of course you may.
And may
Thank
I
you,
ask
Joel.
you, what is it that you do at Access Living?
I do two or three basic things. I do health policy, particularly around long-term care, but also around Medicaid and health care for people with disabilities. I organize consumers around their health care needs and get them to testify, to talk to legislators, to rally, and to do anything necessary to make the system work better for people with disabilities. And then I also facilitate several groups of people that are involved in projects around healthcare, sometimes research, sometimes advocacy and activism.
So you're keenly involved in that interface between government policy and services to the disabled.
That's correct. We work with healthcare providers in a lot of different ways. We try to educate them on what accessibility in healthcare means. We try to get the state to regulate and pass laws that are favorable to people with disabilities. And funding is always an issue. We've seen cuts in Medicaid. We've seen managed care restrictions, which mean narrow networks and harder access to specialists in particular.
And speaking of cuts, it's my understanding that it is a proposed cut that sent quite a few people to Springfield on May 11th to demonstrate?
Well, we've been fighting all year for a budget. Access Living is owed like over $1 million by the state. Other providers are going out of business because of the shortfall in funding from the state. So that's been an issue, but the main reason we went on May 11th, or one of the main reasons, is that we still have people with disabilities who are confined in state-run institutions. And our goal is to close those state-run institutions. We've managed to close a few of them, Lincoln, Tinley Park, and some others. But we still have, I think, 7 more in Illinois. And the ARC of Illinois and other advocates for people with developmental disabilities have set the goal of closing 6 of those 7 by the year 2020. Now, this administration seems to be, what would I say? They seem to be not very receptive to any of our messages, unfortunately.
So the rally in Springfield on May 11th was an attempt to send a particularly strong message to the state?
Yes, because we have quite a bit of support among legislators. So the idea is to build pressure on the governor. You know, this governor is always talking about downsizing the state government, spending money more effectively, so on and so forth. Well, these state-run institutions cost $250,000 per person per year to operate of the residents, right? So, you know, $250,000 is a lot. And if you were serving people in the community, you could be serving maybe 4 or 5 people for the same cost. So the state's is acting foolishly in the way it's spending its money. Plus, these people are not getting the quality of care and the quality of community interface that they really deserve.
So there are some strong arguments to be made in favor of independent living out in the community, not only for the welfare of the individual, but literally saving money for the state, if I hear you correctly.
Both it's a win-win situation in that way, and you have about 19 states that have closed all their institutions.
Now, there are 19 states that have closed all their institutions?
For people with developmental disabilities.
So Illinois is lagging behind those 19 states.
We have historically lagged behind, and when you compare our spending on community living to our spending on institutional placements, we rank about 49th in the country, and the needle hasn't moved very much on that.
49th out of 50 states?
51 if you throw in the District of Columbia.
I can see why this rally had some real reason and motivation behind it.
Yes.
Now, you work at Access Living, but I heard you mention ARC of Illinois.
Yes.
Was this rally then spearheaded by more than one organization?
Yes, the ARC is, I would say, it's kind of an umbrella of many of the providers of services for people in the developmental disability community. And they, along with some of those providers, some of the advocates, Access Living, Equip for Equality, there's the self-advocates group, which are people with developmental disabilities that advocate for themselves. They all are participating in this rally called the Going Home Rally.
So it was clearly a consortium of organizations that spearheaded this.
Yes.
Now, exactly where was the rally held? Because Springfield is a spreading city that covers quite a bit of area in relation to a population of no more than about 300,000, give or take.
Yes.
So where specifically was the rally held?
We had the rally in the rotunda of the Capitol. We had speakers who were actually people with developmental disabilities. One of Access Living's consumers, Chuy Campuzano, was the one who led the chants and fired the audience up at the rally. And we had about 30 plus people from Access Living at this rally in the rotunda.
Now, you said in the rotunda of the Capitol building. So literally you had this mass of people, some of them standing, many of them sitting, right in the center of the ground floor of the Capitol building.
That's correct.
Okay?
And hopefully the legislators could hear us when we were chanting.
And when you mentioned chanting, I take it this was not done in a soft, dulcet tone.
No, we were loud and demanding, because this situation has gone on in a bad way for way too long.
Well, when you say loud or demanding, you mentioned about 30 people who were standing, speakers and the like, but 30 people cannot be terribly loud and demanding. What was the total number of people there?
I was told that there were 200 to 300 people in attendance.
So over 200 people.
Over
Okay.
200 people.
Okay, and Chuy Campuzano, who I believe is also from Access Living,
Yes.
was helping to stir them up as they made their chants?
That's correct. He was leading the crowd in their chants.
And can you tell us what one or two of the chants were? What
Shoot, my memory's not very good for that, but I think shut them down, of course, talking about these state-run institutions, and possibly what do we want? No cuts, because the budgets have been harmed so badly.
Or what do we want? Community living?
Yes, that would be a demand.
Did Chuy also spur the crowd by asking, when do we want it?
Oh, absolutely.
And the crowd said?
Now. Adamantly now.
So from the way you've just phrased that, I take it this was not a shy or retiring group of people in the rotunda.
No, these are people who are advocates. Many of them have probably many of them have been to going home rallies before. I think this was the fourth one. And, the campaign will not end until we close those 6 state-run institutions.
Now, since this was held in the rotunda of the Capitol, did that mean that with the exception of a few people like you, most of those demonstrating came from the Springfield area?
They came from all over the state. There would have been, we take the train to Springfield mostly, but they would have been in carloads and busloads from different parts of the state.
Well, if they're coming from all over the state, did that mean that this was restricted largely to people who are ambulatory on their own 2 legs?
No, not necessarily. There are accessible buses, and on the train we have the advantage that there's lifts to access the train.
So there were people in the rotunda who were literally wheelchair-based who were there as well?
Yes, because people with developmental disabilities can have physical or intellectual or a whole variety of types of disabilities.
But as long as they have their vocal cords, they could participate in the chant.
That's right. And even if they don't, if they shake their hand or make themselves known, they're part of the contingent.
And are making their feelings known in one way or another.
Yeah.
Now, since you were in the rotunda of the state capitol building, did this mean that you sent all the legislators running in one direction or another?
No, but after the rally, of course, part of the activities is to try to corral your own state rep or your own state senator and let them know about these demands and get them on board. Like I said, we have a lot of support, but the governor has been a difficult part of this. If we went back 4 years to the very first Going Home rally, we actually had Governor Quinn at that rally and showing support. Now, his administration wasn't able to get to where we wanted them to go, but this administration doesn't seem to be moving any very quickly on this issue either, unfortunately.
Well, does that mean that groups such as Access Living in Rockville, Illinois, are likely to continue this type of protest activity?
Well, we'll continue to have this movement until people have real opportunities to live in the community and not just be stuck in these state-run institutions.
And do you think there will be further vigorous chants in the future?
There will be a continual and I think maybe growing movement as more people with developmental disabilities get involved. One of the issues, of course, is some of these providers and agencies are so strapped for resources that even advocacy becomes a difficult barrier for them because who knows where the money's coming from.
But it sounds like that's not stopping you from making your voices heard.
No, there's always somebody who's willing to sacrifice and come forward.
Well, we at ADAPT Productions of Chicago are going to watch this with considerable interest because it sounds like there will be more to report on in the future regarding this and related issues. I want to thank you for coming in and speaking with us today.
Thank you, Joel.
That was Tom Wilson from Access Living, who helped to organize the Going Home rally in the rotunda of the State Capitol building on May 11th. I am Joel Margolis, your host for Voices from the Disabled Community, thanking you for joining us today and hoping you'll join us again. Have a pleasant day.
My organization is the Independent Movement of Paratransit Riders for Unity, Vehicles Equality. Joe, what we've been doing for the past 16 years is making sure that paratransit riders are treated with equal rights. We're fighting for our transit freedom. This is a national issue, and Illinois is the worst state for paratransit because we are the largest, and PACE, who operates it, is the largest. What has been happening lately is that since we filed our federal lawsuit in court from 2007 to 2012, we had improvement of service in 2013. However, as of 2014, the service has really gone down, even worse than the original complaint. People are afraid to file complaints. They don't believe that the state, city, nor county is protecting their rights. Most of the riders are seniors. Most of them live on the south side. Most of them are black. It's a very diverse system, except that most of the riders are low income. They really can't afford the fare, and we're having a meeting to help them file their complaints with the federal government. The federal government is in Washington, D.C., that actually sends the funds to the state, is part of the U.S. Department of Transportation. They are part of a system of transportation that includes the Federal Transit Administration. Their Office of Civil Rights asked me to gather and collect a number of complaints from the riders so that we could show a pattern of abuse. Earlier this winter, we had one senior who actually died, who was dropped off at a corner. The driver didn't wait, it was winter. She actually was found walking along the Congress Expressway after she couldn't get into her facility. A taxi driver picked her up, took her to the hospital, where she later died. We don't know her name, so we're fighting for her as well. Our meetings have been basically to improve how PACE delivers services and how they drop people off. People have been stranded up to 5 hours, some overnight. And I'm not speaking of times when there's inclement weather, rain, snow, sleet. I'm speaking of when it's naturally good weather, daytime or nighttime. CDT is the largest carrier, but there is no good service with any of the carriers, whether it's CDT, MV Transportation, SCR, or First Transit, which is the backup to SCR. Some of the riders who are filing complaints have told us that they've actually called the police on them when they picked them up, take them to the wrong address, and they ask them to get out at the wrong address. Now, one of the ladies is 91 years old. How do you do that to a 91-year-old lady? We're disabled. We're not a one-size-fits-all system. The Americans with Disabilities Act guarantees our human rights as people who need this accessible transportation. Most of us cannot ride the bus or train. That's why we're riding the paratransit. If we had our own cars, believe me, we would not be riding and waiting on the paratransit, no matter what the weather. I cannot say much about the drivers because they don't book the trips. These trips are booked through the providers, as I mentioned their names, CDT, SCR, etc. The drivers really get frustrated themselves. But there are a few who have no business working with the public. Some of us are older. We could be grandparents of some of the drivers. We are not always treated with respect, even customer service. But right now, people are afraid to file the complaint. So we have a senior staff attorney from Access Living who is coming to speak, and we're talking to attorneys across the city to come and assure these paratransit riders that they cannot be punished. Most of them think that they're going to lose their service if they file a complaint. When you file with PACE, which I still encourage them to do, you may not get an answer for 2 months. By then, you don't know what the complaint was. However, they no longer put it in writing. They just call you and give you a verbal thing. I just found out recently, even in the blind community, that they're having service. Sometimes they are not, the drivers do not enter the building. I don't know what's happening with their coding, but I know that this service has been in existence since November of 1985. There is no reason why we can't have good service. What we're demanding now is that they stop stranding us, stop taking us hours and miles out of our way. The ride is only supposed to be 90 minutes, and some people are being left in the vehicles 3 hours. They have to take medicine, they have to have their food. Maybe they just want to go to bed. I don't know. But whatever the reason, whether they're going to work, doctor, or whatever, we need equal service. We need service that is comparable to the fixed route, and we're not getting it. And we will not be silent. We're fighting. We will not give up, ever.
And what can folks do?
What they can do is contact Improve. I'm going to give the number 773-544-9488 is our secretary's number. The outreach director's number is 773-703-8412. They can file complaints also at our website, www.improve, that's IMPRUVE.org. We have been in existence since 2000, and we want this service returned to CTA. They should call, write, whatever they can do. We can tell them where they can download their own complaint form, but it's better to do it with a group or through us because they will not do any, they will not pay much attention at the federal level at single complaints, but sending them in a group works. Thank you, Joe.
Thank you for coming to us today.
My
and good
pleasure.
luck with your organization.
All right. Thank you.